Is it loud and clear?
I can hear you clearly,
Okay,
so I
very good.
think that the
Eh,
participants can do too.
Excellent, excellent. Yeah, I put together a little program, and I will talk first about the aims of the personalized healthcare catalyst, what it is, what we try to achieve, and then also what I think is a common challenge we all have to address, and we might be helpful to achieve that. Now, again, the case for personalized healthcare is not difficult to be made. What is it? It is about personalized diagnosis. It's about a personalized care plan, personalized interventions, and personalized remote monitoring care. Of course, the interaction between these aspects together generate what we call personalized health care. It's about health care, so it means we care about our health. It's not sick care, which is usually what people think about when we talk about healthcare. We talk about healthcare, staying healthy, keeping healthy, and recovering your health. That's what we talk about on a very personalized level. Now, why is this important now? It's because on the one hand, we see the opportunities. On the other hand, we see the needs. We see the needs because if we look at the cost involved in our classical healthcare system, it becomes unsustainable. And small improvements now take a lot of time and effort and money. On the other hand, we see all these beautiful developments, both in biomedical science as in data science, as has also been discussed today. And the problem now is that all these developments have to fit in a certain environment, in a certain system. And what we observe is that the science itself runs faster than the frameworks. And then we see that barriers for the implementation of personalized healthcare emerge. And that's especially what I want to talk about, because there is no need to talk about stimulating people to come up with new ideas and new concepts, principles. And we see also now the pitches, it's all there. So that's not what we really need to worry about. What we do worry about is what we call the last mile. Why are there so many good initiatives, successful initiatives, well thought and a lot of energy? And why, relatively speaking, there are so many that do not get to the final scale that we expecting. This, by the way, is also called the Dutch disease, because this typically happens also in other areas in the Netherlands. So it's also an explanation or an example, better said, of the formula I usually show when I talk about this type of issues. And the story is, the formula reads NT plus OO equals EOO. And what does that mean? It means new technology into an old organization gives you an expensive old organization. And we see all these new technologies, but we see here and there a lot of old systems, old organization. And before we know, we end up with this expensive old organization, and people are demotivated, are frustrated, are disappointed. And that should not happen, because like we concluded today, the initiative, the science itself is more than promising, it's already there. So how do we get to this receptive environment? Now for this, and now comes the story of the elephant, it's very good to know that we talk about a very complex system. And we talk about complex topics, complex diseases, complex technology, into a complex system, which we call the healthcare sector. And we are also dealing with complex little things that we call human beings. And this complexity is causing it challenges. And one of the challenges is that everyone in this complex system has its own or her own perspective on what we're doing. And that can be from a patient perspective, can be for a doctor's perspective, for a payer, for a government, for a scientist, for a manager of an institution. That when you come with an intervention, with a new idea, this has impact on all of these different stakeholders, and they see this from a different perspective. And something that looks very promising or very interesting from one point of view could be a threat or a disruption of a business model from another point of view. And you can only appreciate what you talk about, and you can only think about the possibilities and the chances of success if you can see the whole picture. And that's where we use this metaphor, this 6 blindfolded people who touch an elephant, and they touch different parts of the elephant, and they come to different conclusions, what it actually is, what they are touching. Until the moment they start combining their observations. If they say, the one says, I felt this, and the other says, I felt that, then at the end they say, that has to be an elephant. That's no other way of explaining what we're feeling. And that's what we call emergence. Emergence is a property of complexity. Phenomena emerge from complexity, and you only see it when you see it from different perspectives. I also have done a little actual version of this elephant, where you see COVID-19 is also an elephant, and you see also that you can look at this from different perspectives, from a governmental point of view, which is Mark Rutte, and the back you see Van Dissel, who sees it from a health point of view. You see also the young people who see it. You see this mathematician who see the mathematics behind it. You see also our friend Maurice de Hond. But anyway, and this has been said more often, you can only appreciate what the real crisis is, or what the crisis really means, if you see it from all these different perspectives. And then you can also see that certain solutions can make a difference, and certain other solutions might be more difficult to absorb. Now, given that idea, we have built a network, an alliance, a multi-stakeholder alliance, because we believe that if we want to solve this issue of personalized healthcare initiatives not getting to the last mile, we have to mimic, so to speak, the complexity of the system. So you can only solve it when you get all the different stakeholders' perspectives at the table. And when we find solutions, when we're looking for solutions, we try to see these solutions from these various perspectives, which means we have patients, providers, insurers. And the idea is here that we're connecting all the stakeholders across the Netherlands, and maybe also later beyond that. It's built on the idea of the coalition of the willing. We all believe in the potential, like the people also joining today, of personalized healthcare. These people are individuals. Of course, they have their networks, they have their organizations, but they're individuals. This is a complete independent group, and I have to say that Ross has been so kind to facilitate the startup of this whole initiative. But it is just one of the parties, and the agenda is completely driven by the alliance itself. It's full transparent, and it's all based on giving and taking. If you can bring something, you're more than welcome. You're even more welcome if you can also take something out of it, because then we think we have a sustainable relationship with each other. And like I said, our focus is very much on the last mile, to help initiatives, to help people with these great ideas to reach that stage of scale up, to reach that scale of real implementation, of real, what I said, the transition from proof of concept to the proof of business, the proof of reality. We apply what we call this combinatoric innovation approach, which means when you bring people together with all this different knowledge, with these ambitions, with these networks, with these dreams, then there will always emerge things that are worthwhile, that are very valuable. And that's also what we have seen in the past 2 years. It's a very multidisciplinary network. You see very vaguely a lot of parties that behind the people that are a member. We started about 2 years ago with about 10 people to start with. Now I have sent out the invitation for our next meeting, and it contains about 86 people who have been invited to this meeting. So it's rapidly growing, and I am very pleased to invite all of you who can benefit and contribute to this network. So what's the idea? The idea is that when we want to build this receptive environment, we have to work on various issues, on various aspects. First of all, still there are a lot of people who are not so much into depth of knowing about what personalized healthcare really means, what is required to make it happen, but also what could be the added value. So we have been working quite a lot on establishing and demonstrating the value of PHC. That means also that you, when you want to change people, you want to change the system, you want to change organizations, you also have to get a shift in the mindset. And after that, you can start thinking about really changing the healthcare system and do the broad implementation. But the outcome of what we do, that's also why we call ourselves a catalyst, is to create this environment where all these fantastic initiatives are being accelerated. As you know, a catalyst is a substance that speeds up processes without being consumed itself. That last part is also quite relevant here. So what is the strategy that we follow? It's a three-step approach. First, we have to inform people. we have to start the dialogue about opportunities and barriers when we talk about personalized healthcare. We have to activate people. We have to activate that people get engaged, get commitment, and they start looking at these barriers and also the enablers, and see how we can work with them, how we can remove the barriers, and how we can leverage the enablers. And then what we also do, we accelerate. We want by being part of the field, and not just looking at it and consulting about it or thinking about it. No, we active in the field. Our members are active in the field. Then you can also really accelerate things, and by doing so, you can both prove the value of personalized healthcare, as well as prove that indeed, when you change the conditions, you can speed up the process and you can really get faster and better into that last mile. So what did we do? We did a number of studies. This is this informed phase. And one of the studies has been done by Gupta Strategies for us, and they have done a lot of study on what we call NS1. That's I don't need to tell you that that's in fact the whole idea behind personalized healthcare. It's about the individual not being an average person, but is a unique person. And the interesting thing is, of course, as you know, that if you want to deliver personalized healthcare to an individual, you need data from a lot of individuals. That's the interesting thing. That's also the challenge that we will talk about. We did also, and I will show some of the results out of that study. We did also a study on what are actually the implementation barriers. And for that, we also work together with the Institute of Brilliant Failures, which I also am involved in, of course, as the CFO. I'm the Chief Failure Officer of the Institute of Brilliant Failures, but we have been explicitly focusing here on implementation barriers. Then also we have put together a so-called manifest. A manifest, which is a message to actually everyone. Everyone, listen, this is happening, this is possible, and this is where we are, and we could be much further if we could get our act together. We should not accept that we are not getting what could be possible. And that's what the manifest is all about. People change policies, and policies change healthcare. People change the system, and we need to change the system. And of course, part of the whole infrastructure, whole environment that I talk about is also the data environment. And for that, we also have done a study on what actually are the barriers and the opportunities now for sharing data in the healthcare environment, and especially those data related to personalized healthcare. Out of the NS1 study, we also have made an inventory of various diseases and asked ourselves, where are they on the scale of precision medicine? And we use for this the so-called 4 Ps. It's the P for participatory, the P for predictive, the P for preventive, and the P for precision. And these 4 together, we analyze how predictive is it, how participatory is it, how preventive is it. And so we looked at these various disease areas and try to create a kind of overall index. Where are they on the scale from, in this case, 1 to 4 in the area of predictive medicine? And then you see very interesting things, not completely surprising, but for instance, the cancers are more or less the leaders. And then you have a series of followers, including rheumatology, you have COPD, diabetes, heart, and then you have the laggards, and then you find very big areas of diseases like the mental disorders and also the things like asthma, and you will find them there. And that has quite a lot of impact on people and quite a lot of impact on society. Now, the idea here is that if we only would be able to mobilize what's already known, what is already possible, then the conclusion could be that we can already gain healthy living years now in the order for 3 to 5 years, just by applying what's already possible now. But we are simply not able to apply it. So we can move on in developing a lot of new science and a lot of new data. But if we put this in a system that is not receptive, that is not the right climate, then we lose health. That's unacceptable. So this is for us the wake-up call, and especially when you look at the laggards in this picture, there's a lot of health still to be gained. And yeah, I already referred to this document also about why it is so important to focus on the data sharing and where are the barriers. And then you think, and the obvious ones are, well, of course, you have to have good data, you have to have to arrange for the ownership of data, you have to have access to the data, but the data also have to be in a certain shape to be able to be combined, the standardization. But then, of course, you also get the legal issues around privacy, which in certain countries, with the same legislation, actually, are all based on the GDPR, the European rules for privacy, have been dealt with in a different way. And we see best practices in other countries where people can make easier use of health data than in our country. So there's something to learn from. And of course, I don't say we should give everything away, make everything open for free. But the interesting thing is that citizens and certainly patients are expecting that more is happening with the data than is happening nowadays. So we are underutilizing, in fact, the data and the access to data that could be possible. So like I said, the idea is that we could, now easily is said too much, but we in potential we could gain a lot of healthy time in the order of 3 to 7 years. And for that, we need to work on these various streams that we have identified. We have to generate the evidence, how important it is and what is at stake and how we could benefit. We have to think about this data. We have to use and develop the right legal framework. Then, of course, we now also talk about the last mile. This all has to be put into the clinical decision support. We need to have citizen engagement and trust. And of course, this is also about organizations with people who make money and who have to survive and want to make some profits, have to be sustainable. So the impact on the economics is also very important. So if you develop something that at the end of the day will cause a bleeder for a certain party, then of course you have to address this. And if this means extra money for the whole system, you have another discussion. So part of what we try to achieve is also prove that overall this is also from an economic point of view a very good thing to pursue. That's also why we have thorough discussions with the Ministry of Economic Affairs, because this is something that will bring also, of course, in the first place, societal value, health value. But if we are smart, and of course we are smart, it can also bring economic value, and it might even, our solutions might also turn into export products. Now, the activation, like I already said, we have drafted a manifesto, and just to create awareness, this is possible, and if we don't take action now, this is what we will not achieve, and that's a missed opportunity. And we need to accelerate. That is the call for action. We have also, and that was more or less the start of the whole initiative, we work with a hackathon, or especially now on NSCLC, we have done a very interesting project that, well, of course, what people try to do, of course, is to create a predictive model. But the most of the added value of this project is it taught us how difficult this is, how difficult it is to get to the right data, how difficult it is to combine data because they have different standards, how difficult it is to understand where are the gaps in the data, and also how to help people understand how important it is that you do not compete on the data, but you compete on the application of the data. And this is has been proven a very valuable project, and it has also demonstrated to us where all the relevant issues are that we need to address. Now, then, like I said, it's very important that you show people how it works, that you show people in the practice where it is, where is the data, where is the personalized healthcare. So a good example of very concrete projects, which we call acceleration projects, are what we call the multi-stakeholder journeys. And we are used to patient journeys, but that's only one perspective. That's not the elephant. The elephant is in the multi-stakeholder approach. So what we have done, we have we started with two disease areas. One is the rheumatoid arthritis, and the other one I will show you is depression. And we just walked with the various stakeholders. First place, of course, the patient, but also the health professionals, the doctors, but also the insurance companies. What happens if you take that journey, and where is data playing a role, and what would be different if the data would be freely available. What would be the cost? What would be the benefits? And so what we do at the end of the day is make a kind of projection of the whole multi-stakeholder journey on this PHE landscape. And then by itself, you see the barriers and you see the opportunities. And that's addressing those barriers, addressing those opportunities. That's at the end of the day, the acceleration that we talk about. And out of that come indeed, and out of this project came four and even more very concrete interventions that could lead to this acceleration. Now we have worked with the rheumatoid arthritis, as I said. We also work with depression, and we have identified a very interesting tool that could be developed that will help not only professionals to help people who have problems, mental problems, but also the friends and family around them. So that's these are things that became quite clear. Yeah, what I said, what is the focus of what we do? The focus is on creating a receptive environment for all these initiatives, and also all the things that have been discussed today. And like I said, we call this the last mile. Yeah? And the last mile is now achieved by helping everyone to understand why this is so important. So we work on a national action plan, and then on these three key stakeholder groups, the citizens, including the patients, the doctors, and the government. And we think about debating, we think about a kind of donate your data show. We have now this exercise, of course, that you're being motivated, stimulated to donate your organs after you died. But why not donate your data where you're still alive? And of course, in a very respectful and responsible way. But for those purposes that you think that's important to share your data for research, or also for better treatment of your relatives, better treatment of yourself. So we need to develop the right settings and the right conditions for us to be able to donate our data in, like I said, in a low barrier, responsible way. We also do a lot of communication where we talk at many places. I'm very honored that I'm allowed to do the keynote speech here. But we also issue magazines, including well-known people like Mark de Hond and Bibian Mentel, who are in this scene. We present at many places in order to be able to motivate people to think about these barriers and collectively start dealing with them. I think it would be nice also to show a little movie. I mentioned already the name of Bibian Mentel, and in this very wide group of multi-stakeholders, there is one that is of course the most important one, and that's the patient. And there is no one, I think, better able and capable of sharing the message of the need for PHE and the need to take action than Bibian Mentel. So I'm happy to show you a little movie.
I'm not hearing audio, I think.
Oh, you don't hear the audio? Okay, how can I change that? That's interesting. Maybe Martijn, does it work now?
No, I'm not hearing audio.
Did you hear it now, Martijn?
No, I didn't hear the audio.
Okay, no, then I will send the link where people can find it. But actually what Bibian is telling us that she is now in the hospital when this was recorded, and that she in her whole life has been always looking for opportunities. And when she got sick, she also looked for opportunities to get better. And she searched the internet, she searched the whole world for solutions for her diseases. And what she discovered is that she is mostly helped by people who work together, who share their information, who are really open for new developments. And that at the end of the day is the only chance she has literally to survive. So I think this type of messages are important and should make us thinking about really putting even double energy in resolving the issues that we see, resolving the barriers that we see, because like I said, a lot is possible, a lot of genius, both on the biomedical side and on the data science side. Our task is to create an environment where all these initiatives, all this energy, all this knowledge can be combined and really push personalized healthcare forward. That's what the Alliance is all about. This is what I think is crucial now. And that's also why I invite all people now also online to work on. And if we can help, or if you want to join, just let me know. You're very much welcome. But like I said, the personalized healthcare is an elephant. We know elephants have a very good memory. They are good in data capturing and data storing. Now let's use it and make sure that the PHC moves even faster forward for all of us. So thank you for inviting me, and thank you for your attention.
Thank you, Paul. Yeah, we'll take care that if you send us the video, that we'll share the link also with the information from the seminar. I have one question to you. If you look at first a remark, because it was interesting to see that in the graph that you showed with the different kind of diagnostics and diseases and how personalized they are, that the personality disorders are the least personalized diagnostics or treatments because they were in the left corner, which is kind of interesting to think about, I think.
Yeah, that is generally being confirmed that these are the life paths, and where it is really, if something really is personal, you would say it's your mind. And still, when you have some problem there, everyone is treated more or less on an average basis. Of course, I mean, we should make a difference, and I don't need to tell you, but I do. There's a difference between personal and personalized. Of course, everyone who gets to a psychiatrist or whatever professional, he or she is doing the best, and he looks at the story and so on. But the equipment they have, the tooling they have, is far from personalized.
Interesting. And the question would be, because you used the example, the elephant, as the way that how you look at it. But of course, there's also another saying with an elephant, that how do you eat an elephant? You do it in pieces. And in a way, you are talking, sort of taking the whole systems approach instead of a small example and then build upon that, as far as I understand. How do you look at that?
Now that we look at various examples, but then you see, and then we do system analysis as an example, and we also look at things in an example for early access. Now, and a great initiative in that area is My Tomorrows. They try to help people who have no options left to get them in contact with therapies that are not yet on the market. And then you see that everyone agrees that this is very useful, and sometimes it's even the place of last resort. And still there are hurdles. And we try to analyze what are these hurdles and why are they there, and how could they be removed. And then we don't change the whole system, but we do system analysis to find out why is that. Another good example is the pharmaceutical passport. Everyone agrees that could be that's interesting. It works. It's being applied, for instance, in the area of Rotterdam. But why is it not used throughout the country? What is stopping that scale up? And by doing and it's not necessary that we just want to help the pharmaceutical passport or My Tomorrows. What we want is to understand what is happening, so that other initiatives can also benefit from these new insights.
Here. Okay, thank you very much for your presentation. Yeah, normally, and that counts the same for the other presenters, I would hand over a bottle of wine, but that's digitally a little bit more difficult. So what we will do, and that counts for the other presenters too, we will send everybody a voucher, all the presenters, for flowers that you can pick up at your local flower shop. So thank you all for presenting there. We're at the end of our program for today. Seminar like this is a bit of a, sorry, Marco, you? Okay, so I thought you had a question. A seminar like this is a bit of a challenge in times of Corona, but I hope you have enjoyed all the presentations. Special thanks I would like to give to Marion Schouten, Valentina Smit, Pedro Herkens, Marieke Snieder, and John Schalke for the organization of this all, and it seems that it all worked quite well, I think, also including the technology. And of course, a special thanks for our sponsor, Johnson & Johnson Innovation. Networking is, of course, always in normal situations an important part of a program like this. There is the possibility to talk a bit further in the Zoom rooms if you click on the link that will be that is in the program for the last part, and there are several of the presenters are able still to talk a bit more informal with people that are interesting. But before we go there, I would like to ask everybody to fill in the poll. Maybe Marianne, you can start a poll to do a bit of an evaluation of this this seminar. And there is the poll. And from my side, thank you all for the attention. Thank the speakers, and hope to see you all soon again in real life. Stay safe, and hope to see you next year at Innoboot in April next year, but then in real life settings. Thank you.